Cortisol is a major stress hormone. This means it increases in response to stress, both psychological and physiological. Normally, cortisol levels are higher in the morning to mobilize energy for the day. Also, during stressful situations, it increases glucose production in the liver, a process called gluconeogenesis. It is important for instant energy. Cortisol also increases vascular tone, helping to keep blood pressure stable, and temporarily suppresses the immune system to reduce unnecessary inflammation. While cortisol is helpful in stress situations, in chronic stress and anxiety, constantly elevated levels of cortisol cause immune suppression, increased susceptibility to infections, and slower wound healing. It also increases muscle breakdown and muscle wasting because glucose is produced from muscle tissue, eventually leading to weakness. On the other hand, high cortisol levels leads to obesity due to fat accumulation. This occurs because constantly elevated cortisol levels result in more glucose production. And when glucose is not used, it is converted into fat, especially belly fat, which is more harmful than subcutaneous fat. High cortisol levels can also cause hypertension and increase the risk of diabetes due to hyperglycemia. The main point is that by decreasing cortisol levels, we can reduce the negative impact of chronic stress on the body. The first and one of the most effective natural ways to reduce cortisol is moderate intensity exercise. While intense exercise increases cortisol levels, as does a sedentary lifestyle, moderate exercise can include activities such as walking, cycling, jogging, and yoga. Moderate intensity exercise is defined as when the heart rate is around 100 to 140 beats per minute, or is challenging enough to increase your breathing and make you sweat, but not so hard that you can't hold a conversation. Regular moderate intensity exercise can decrease cortisol levels by around 20%. This type of exercise is best done for 30 to 40 minutes daily. The second way to reduce cortisol is through deep breathing techniques. These activate the parasympathetic nervous system and reduce cortisol levels by up to 20%. This breathing technique involves deep breathing. Inhale deeply through the nose, expanding the abdomen, and exhaling. Inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and hold again for 4 seconds. This is known as box breathing. Sleep for 7 to 9 hours reduces cortisol levels by up to 3%, while sleep deprivation increases cortisol levels significantly. It is important to maintain a consistent sleep schedule, create a dark, quiet sleep environment, and limit screen time before bed. Spending time in nature and green spaces also improves and lowers cortisol levels. Spending 20 to 30 minutes in nature can reduce cortisol levels by around 15%. This can include forest bathing, theme park visits, and outdoor walks. Another way to reduce cortisol is by spending time with family, friends, and loved ones, which can reduce cortisol levels by around 25%. Regular communication with loved ones, especially in-person interactions, significantly lowers cortisol levels. Humor and laughter are important and effective for reducing stress. Laughter therapy has been shown to reduce cortisol levels by up to 40%. This can involve watching comedies, spending time with fun people, and engaging in lighthearted activities. Laughter yoga and laughter therapy are considered some of the most effective practices. They involve voluntary laughter combined with breathing exercises, usually done in groups. In this case, participants laugh as a form of exercise without relying on jokes. Each session typically lasts around 30 minutes. Another method is listening to music, especially classical music or nature sounds. Classical music, such as pieces by Mozart or Bach, is known for its soothing tempo and lack of lyrics, which promotes relaxation. Additionally, nature sounds like rain, ocean waves, and bird calls help lower stress hormones. Listening to music for 20 to 30 minutes in a quiet environment is usually enough to lower cortisol levels. Now let us talk about supplements that reduce cortisol levels. Ashwagandha is known for its cortisol lowering effect. It can reduce cortisol by around 30%. According to several studies, daily intake of 300 milligrams of ashwagandha decreases cortisol levels by around 30%. Ashwagandha is considered an adaptogen, meaning it helps the body resist stress by affecting the hypothalamic pituitary, adrenal axis, and decreasing cortisol synthesis. Ashwagandha is considered safe for short-term intake, typically around 30 to 60 days. However, the main limitation of ashwagandha is its sedative effect, and it also stimulates the thyroid gland. We should be cautious with people who have hypothyroidism, as it may raise concerns about the risk of stimulating thyroid cancer with prolonged use, although no direct correlation has been established. Phosphatidylserine is another supplement that reduces cortisol levels and improves recovery after physical or mental stress. 400 milligrams of phosphatidylserine can reduce cortisol levels by around 30%. Phosphatidylserine is a component of brain cell membranes and is important for the production of neurotransmitters. It influences dopamine and serotonin levels, helping the brain cope with stress more effectively. Phosphatidylserine is generally considered safe, especially for short-term intake, meaning 2 to 3 months. No significant side effects are noted at doses up to 400 milligrams daily, although gastrointestinal symptoms are sometimes reported. Omega-3 fatty acids are beneficial for many conditions, including reducing cortisol levels. They have anti-inflammatory effects and improve hypothalamus pituitary adrenal axis regulation, reducing cortisol by up to 20% with a daily intake of around 2000 milligrams, including both DA and EPA. L-theanine also reduces cortisol by promoting relaxation through increased alpha brain waves, which are associated with calmness. 200 milligrams of L-theanine can reduce cortisol levels by up to 20%. Especially during acute stress situations. A typical cup of green tea contains around 20 milligrams of L-theanine.